Joseph is a 75-year-old man who suffers from heart failure.
As a result of his heart failure, last year he visited his doctors 24 times, was admitted to the emergency department 9 times, and occupied a bed in hospital for 14 days.
His illness is monitored by a multidisciplinary team of doctors, nurses and social workers at his medical center and at hospital. Yet a lack of coordination between them and a diversity of criteria mean that sometimes healthcare processes are repeated or important tasks forgotten. All of this negatively impacts on Joseph's health, generating unnecessary cost. In many cases, a specially trained expert is required to manage chronic patients' healthcare. It is often the nurse case manager who is tasked almost exclusively with this job, mainly due to the difficulty of integrating these tasks with the daily work of the other health professionals who see Joseph. Monitoring is done via Joseph's medical record, yet this tool is often designed just for professionals and tends to be reactive rather than proactive. This means that it doesn't guide and plan the next steps in patient care, but simply displays the previous tasks performed with Joseph. In fact, when professionals visit Joseph at home, they primarily fill in forms and notes on paper, which are then transferred to the patient's respective medical record. This is when errors can be detected in the work carried out. This situation hinders proactive, continuous monitoring of Joseph's case. Even more so when the family doctor or nurse makes a house call on Joseph, only to find he was admitted to hospital the night before because of serious fatigue. In hospital, neither do they know that Joseph is being monitored at his medical center, nor do they know the results of that monitoring. All of this leads to tests and questions being repeated, as well as the treatments that will come after. Likewise, if the town's social services knew of the existence of high-risk chronic patients within their territory, they could align and coordinate suitable sociable diagnoses better with the health services. Furthermore, Joseph's son Philip, who acts as his carer, has no access to any information, even though he helps his father comply with the prescribed healthcare plan. Philip is also affected by the constant repetitions and duplication in their rounds of the different medical and social services. The INCA project aims to change the manner of caring for chronic patients through more efficient management of social and health resources while empowering patients in their environment. This is the objective of the 5 pilot schemes that the INCA project is developing in Spain, Croatia, Cyprus and Latvia.
INCA aims to demonstrate that this initial rollout of integrated social and health care is viable by creating a virtuous circle of well-coordinated care surrounding the patient.
So how does INCA achieve this objective?
We enable coordination between members of the multidisciplinary team, providing care through a cloud-based tool that overcomes the limitations of each silo and each entity.
We develop an integrated plan for social and health care that becomes a continuous flow of action for all participants in the care plan. We make the patient a participant in this flow of care, allowing him or her access to all of the information generated in this process. And we measure whether compliance of this strategy enables us to improve patient satisfaction and the patient's environment, postpone high-risk chronic conditions or even lower their mortality rate, and at the same time optimize the use of social and healthcare resources. INCA, social and healthcare integration made easy for everybody.